So the topic that came up frequently in what was being requested was self-care and how to take care of ourselves while doing this work, because the work's important and can only be done really well when we are healthy and well. Sorry, get distracted again. So I titled this "Don't Lose Your Dinosaur," and if you do lose it, how do you find it again? Again, I'm Dr. Becca Tagg. I'm a licensed psychologist. So let me just, yes, I will email the PowerPoint out to everyone afterwards. I generally don't send them in advance because I find when I do that, then people are looking at the PowerPoint at their own pace, which is great, but we have less participation. And so I'm happy to send it afterwards. So who am I? I've got a master's in school psychology. I'm a nationally certified school psychologist. I'm a BCBAD. I'm a licensed clinical psychologist, and I did a postdoctoral master's in clinical psychopharmacology. So I have prescriptive privilege where permitted. I also dropped out of high school, right? And so why is one more important than another, or is one more important than another? Why are these things much easier to kind of talk about than maybe some of the others? I'm the executive director at Del Mar Center for Behavioral Health. We're a multi-specialty clinic in Southeastern North Carolina. I have a podcast in the business of behavior, which offers consulting to other business owners that serve sort of in the mental health or human services field. But I'm also a sister and a wife. This is my sister and my husband at a Steelers game in San Diego. I'm originally from Pittsburgh, got 2 pugs, lots of tattoos. I love coffee, the smell of patchouli and tie-dye. I'm also diagnosed with multiple sclerosis. So often when we meet people, we focus on like, this is my friend who is a ... a psychologist, an RBT, a speech path, whatever it is. And sometimes that means that it is harder for us to remember to nourish the other areas of our life. And sometimes that can make it more, we are at increased likelihood for burnout. And we do hard work, right? And so we need to make sure that we're nourishing all of the areas of who we are. So yes, I'm a psychologist. Yes, I'm a BCBA. And I love hanging out with my pugs and my partner and getting tattoos and all of these other things. So why do I talk about this topic? And really it's because I lived it a couple of times, right? So I started as a school psychologist, and fresh out of school, I was assigned to, I think I had 4 schools, and I felt like I wasn't doing a very good job. And I started to burn out really after 4 years. And I didn't know that's what it was. I actually just thought I sucked at this. And I just kept thinking, how did I go to college for 7 or 8 years for something that I'm going to be paying on my student loans for a really long time? And I actually am not even going to be doing this work because I suck at it. Really internalized it like it was me, something was wrong with me. And what I learned was that there were some system challenges, right? Working in the public schools. Some of you guys may work in the public school or in an educational setting, and so that may sort of ring true for you. But a lot of it is there's just not, it's not set up to be well, right? There's always more students than you can serve, and there was always work to do. And the reward, in air quotes, right? The reward for doing a good job was actually more work. And so if we know what reinforcement is, if we know what reinforcement is, and I'm doing a good job and you're giving me more work, is that reinforcement? Spoiler alert, it's not, right? It's not desirable. It doesn't leave me feeling well. And because there was always more work that needed done, and I am a recovering people pleaser, and struggle from helium hand, right? The balloon that pulls your hand up. I wanted to please. And so anything that needed done, I just said, I'll do it. I'll do it. I'll make it work. And so I just kept doing it. And I had a supervisor who told me that I would die with a full email inbox. And I remember thinking, oh God, that's morbid. But now when I reflect back, she was right. And what she meant was, no matter how much I work, there's always going to be more work. And that's a blessing and a curse, right? It's awesome because it's job security. It's also awesome because I love what I'm doing, but it's also really hard because it's hard to set boundaries. And when we're saying I can't do that or I can't take this on, I'm saying there's a family I can't help or won't help, or that there's an individual who may not be getting what they need. It's really hard. I so love what we do and want to be able to keep doing it. And these were things that really weren't talked about much in my training until I experienced it. And then I went back and respecialized from school psych to clinical psych. And that was actually the topic of my dissertation and subsequent research is how do we take care of our direct care staff? How do we take care of those people who are working with humans day in and day out? So the title of the talk being Don't Lose Your Dinosaur. Has anybody seen the movie Step Brothers? You can put a yes or a no in the chat. Nope. Okay. Yes. Okay. So I'm glad to see some yeses for a variety of reasons. And it's one of my favorite movies because it's just silliness. And so I see people have their hand raised. I think that's what I'm not sure about. You could just use the chat function. I do appreciate the interest. Please just chat whenever you feel in the chat box or the Q&A. So yeah, more than twice, you and me both go. If it's on TV, I'm like watching the whole thing. And I probably could put on a one-person show of it. And there's so much room for activities. Yes, Megan said, did we just become best friends? Which is one of the great lines of the film. So the reason that I picked this sort of, there's this scene in here, right, where I'll give you the backstory. So here we've got Brennan on the left, Will Ferrell, and Dale on the right. And they're sort of they live their life on their own terms, right? So they've got movie quality Star Wars masks, and they've got Playboy like nudie mags from the 1970s till, you know, whenever the movie came out, and they wear night vision goggles, and they want to turn their single beds into bunk beds, right? So they still have that childishness, right? That zest and joy. And this is their dad. And so the Dale and Brennan get told they have to grow up. They can't keep living like this. And his dad and stepmom, which is Brennan's bio mom, tell them they have to kind of grow up. And so they get these jobs and kind of become boring humans, reading books and going to bed at 8 p.m. So then this scene, dad here is telling them that it really breaks his heart to see them like this. And dad saying, when I was a little boy, I always wanted to be a dinosaur. And then, you know, Dale saying, well, you're human. You could never be a dinosaur. And then the dad's talking about, you know, he always wanted to be a dinosaur, and he thought he'd go to medical school and kind of put the dinosaur thing down, as he says, and that after medical school, he'll come back to it. But that after medical school, he just forgot how to be a dinosaur, and he lost his dinosaur, right? And dinosaur as that analogy of that zest and curiosity and excitement and wonder that we have as kids that we sort of lose as we get older. And we might be really excited at a new job, and that might fizzle out too into this, right? But we have so many kids and adults that need, and families that need our help. We can't afford to lose you, right? We can't afford for you to lose your dinosaur, because what you have to offer is so valuable and so great And when we can help you and me, right? This is a desert grain of sand situation. When we can be well, we can continue to serve others. And while we're going to talk about this in the context of work, a lot of what we talk about is going to be applicable to other work relationships or other like life stuff. So momming, right? Or maybe you run the PTA, or maybe you run a kickball team, whatever it is that you're running. Anytime you engage with another human, we're at risk for burnout. It's extra important. Maybe you've seen the movie The Help. If yes, then hopefully that chocolate pie of minis will make you chuckle. But 2020 was a hell of a year, right? And this is data from the American Psychological Association. They did a survey, and this is some of the data. I'm not going to read it to you, but spoiler alert, everybody's struggling. Okay. People are reporting feeling worse than they have in the last 12 months, feeling like the amount of stuff that's needed from them is too much, feeling like they don't have enough support, or that they would have liked to have more support. And these are not small numbers, right? We're talking like 70s, in the 70s, 60, 78%. And so we're talking about the COVID-19 pandemic. We're headed into 2022 in, I guess, 2 months now. And a lot of those same stressors are still there from 2020, right? And so that means we're almost 2 years in. So we're looking at chronic stress. And this is contextual stuff, right? So these are the things that we're all experiencing on top of the regular humaning stress that's hard. So I just turned 40, I guess 2 weeks ago or so. So like on top of just being an adult, like I have to pay my mortgage. I gotta make sure the dogs get to the vet. I have multiple sclerosis and I take chemo. So I gotta be sure I've got my chemo and that I've got my blood work on time. Like I've got to pay bills. I got to run payroll. There's like all of these things that I have to do that are outside of 2020, right? Outside of having a chronic health issue, like outside of all these other things. And so we as humans are having a hard time, and that puts us at risk for not being as healthy and well. So what is burnout? This is the definition by Maslow, Jackson, and Leiter. This is the sort of clinical definition. Burnout is a syndrome of emotional exhaustion, depersonalization, and reduced personal accomplishment that can occur among individuals who work with people in some capacity. So if you want to put in the chat box a yes or a no, if you interact with humans at any point in your day-to-day sort of goings on. Yep. And probably lots of humans, right? From my partner to our colleagues, to my team members, to parents, to my doctor calling to make an appointment, right? I'm engaged, to the person who cut in front of me when I stopped to get fuel. We're engaging with humans all the time. Not that I'm still holding on to that or anything, but we're engaging with humans, and humans are unpredictable. And so that makes it extra hard. So I want to be sure that we do a little comparison between stress and burnout. So stress is a normal part of life. Our body is built to use it, right? So when I was in graduate school, I got a little stressed out before an exam, and I would study, and then I kind of got my ass in gear and would do better, right? So a little bit of stress is a good thing. Maybe before you took your RBT exam, if you're an RBT, or before you had an interview, or before really anything, you get a little stressed and it kind of kicks your tail in gear. You study, you get prepared, and you do well. But stress is good for a short period of time. We have two, I won't get too into this. I also realize I'm prefacing that because I know I'm a nerd about physiology and not everybody else is. So we have two autonomic nervous systems. So systems we don't control, they're automatic. We've got our sympathetic nervous system and our parasympathetic nervous system. So our sympathetic nervous system is our fight, flight, freeze, and fawn. Those are our 4 responses to stress. It's meant to act for a short period of time, And then our parasympathetic, which I always remember because the parachute, like para, slows you down, is supposed to kick in and sort of tell your body you're safe, right? There's a great book called Why Don't Zebras Get Ulcers? And it's basically that zebras, they're eating grass, doing zebra shit, and then they see a tiger and they run. Then when they're away from the tiger, they go back to eating grass and doing zebra stuff because they're not worrying about the next time they see a tiger or the last time or what ifs, right? But that's what humans do. And so sometimes our body doesn't know, that parasympathetic nervous system doesn't kick in to go into what's called rest and digest, right? Which is lounge and living your best life. There's no tigers, right? But our brain, our thoughts can make us feel like there's a tiger here. Zebras don't do that. There's a zebra, or if there's a tiger, they run, right? If there's not, they don't. But humans, our brain sort of does us dirty sometimes, right? It'll make us think there's a tiger when there's not. So that's when we move towards this sort of more burnout, where we've been operating at chronic stress levels. So our sympathetic nervous system, we've been in this high stress state for a long time. And that can lead to burnout. So they're not the same. Stress over a chronic period of time or a long period of time is or can lead to burnout. Stress is like this, there's so much going on, gotta do. And burnout is like, you can't even. Like, it's that detachment. There's hopelessness. You don't think it's ever going to get better and you're just over it. There are some risk factors of burnout. High and unrealistic work demands, particularly when there's imbalance between what's expected of you and the resources. Conflict in the workplace. Younger and single employees are at greater risk. Employees that define work as the primary source of sort of defining yourself or accomplishment. Long work days, isolation, higher levels of education. Remember that first slide with all those letters after my name? This is why I talk about this, right? Because I've lived it. And then specific for a lot of us is also this challenging client behaviors. Because oftentimes, if we're working with individuals, it's because they have some interfering behaviors, right? Either some behavioral excesses or deficits, if we're talking about related to autism and other developmental disabilities. And some of this is because you just never know what's going to happen, and that can create some anxiety. So you're almost always on edge, right? You're almost always prepared for something. I mentioned I have 2 pugs, so you will see pug pics embedded throughout the PowerPoint that hopefully helps to add some brightness to a sometimes tough topic and important topic. So stress has some negative impacts on the body. So long-term stress is, again, that constant stress, where acute stress would be if a lion ran in here or a tiger. That's acute stress. In this moment, I'm terrified. And then when I'm safe, I'm safe. And again, that chronic stress, the challenge is that the body does not receive that signal that it's safe and to return to normal. It impacts almost all of our bodily systems, our immune system, digestion, cardiovascular, sleep, reproductive. And our body is a system. So all of these systems are interconnected and have to be working well so that we can be upright, oriented, oxygen to our extremities, and delivering reinforcement and discriminative stimuli, right? It's a lot. There's also other impact of stress. So social interaction is impaired. We often withdraw because these systems are impacted. We're more likely to get sick. There can be financial impact, right? Because maybe we're not able to go to work because we're sick, which is directly caused from the stress that may be coming from work. And then there's emotional impact. You just feel crummy. It doesn't feel good to be stressed for a long period of time. Even a short period of time can be uncomfortable. A big part of it is being aware of it. So we need to be aware of when we or others are not at our best. And so if you think about it, what does it look like or sound like or feel like when you're stressed? I'd love to see in the chat box maybe some of those behaviors that you notice in self that tell you that you've been under stress. Yep, I have a hard time paying attention to something. I forget things. Tight, that's a good one. My shoulders will be like daggone near touching my earlobes, and my tongue will push against the roof of my mouth. And I'm like, where'd that come? Yep, bouncing, forgetful, curt. That's a lovely way. I'm irritable. I'm sort of like, I can be more rude. Paralyzed. Yes, that freeze. Trouble sleeping. Jen, I love that you mentioned difficulty sleeping, because for some folks, and I think I saw earlier up, they might sleep more. So really, it's not that more or less sleep, it's, is it different for you? Is this different than your norm? And if it is, that's when we might want to say, hey, something might be going on here. Yep, irritability, preach it. Lack of patience, yes. And oh, that persistent furrowed brow. So I love that, Brian, because that's telling me you're really aware of what your body's doing. I so often don't notice. This can also happen if you're stressed and then you realize you haven't eaten all day and you're starving, right? And you're like, oh, damn, I wasn't even paying attention to my body. Yes, you guys are really aware of these in yourself. And then we look for patterns. So am I more likely to have my shoulders up and tense after certain activities or engaging with certain people? If yes, I might want to do something different, right? When we see those patterns, we get to decide how to respond, because it's always an option to keep doing what we're doing. So if I notice that every time I see, so I'll share a work example. When I see one of our TRICARE, I wasn't going to label it and I couldn't think of another word. So one of our like payers is calling, I kind of like, right? Like I just felt my stomach tense, my shoulders kind of went up, and I was like, right? Every time. That's a pattern. So I can have a couple options, right? Either I can hire somebody to take care of that, which we have. And some of it I still have to navigate. So I get to choose how to respond. So if I've already had a crummy day, I'm not going to pick up the phone, because I can't have crap on crap, right? I'm already tired and irritable and have already been dealing with stress. I can't take this other stimuli that I've already acknowledged is an additional stressor. I can't handle it right now. So I'm going to later it, right? They can leave a message and I can call them back. Very rarely is like 0.01 is it the life or death situation, right? And if it is, they'll text or they'll keep calling, and then I can pick it up. We get to choose how to respond. And that's one of the things that took me a long time, was feeling like, for acknowledging that I can choose to respond in a different way. Change is constant. Stress is a given. And the way that we choose to respond to the things happening around us is generally what moves us towards or away from health and wellness. And I want for all of you to move towards wellness, because I know how crappy it feels to not be there. Another option is to call the process. So just labeling, I'm feeling really stressed. I'm noticing TRICARE is calling and it's making me want to barf. Or I see the next client on my schedule is one that we had a session with a lot of maladaptives last time, and I'm feeling sort of stressed. Sometimes just saying it out loud, it's like, do you remember being a kid and you might have been scared of the dark and you were convinced that this thing that you saw in your closet was a monster? But then you turn the light on and you see that what you thought was the monster's arm was the sleeve of your favorite sweatshirt. What you thought was the monster's body was just the bottom of that sweatshirt. Sometimes when things are brought into light, they're just not as scary anymore. And so just that name it to tame it, calling the process, and then being focused on the present moment. In this moment, I'm uncomfortable in this phone call, and it's not going to last forever. The story I tell myself during times when a patient might yell at me, a parent's yelling at me, a staff member's upset with me, the story I'm telling myself is, Dr. Becca, you failed. You're not doing anything good. You're horrible. Like, this is never going to end. And I just say, self, it is going to end. It's uncomfortable in this moment, and it's not going to last forever. And sort of staying grounded in that moment. Ride the Wave is a great, my business, our clinic is called Del Mar Center for Behavioral Health, and Del Mar is of the ocean. And that's exactly why, right? That the ocean is such a great model of the fact that the waves will continue to come, and no one wave, no matter how big or small, will last forever. And we have options, right? Either I can duck dive under the wave. Any surfers here? Put a yes or no in the chat. So surfing is fabulous in a variety of ways. But so this big wave comes and I can't go, okay, ocean, nope, no big wave for me. I mean, it's coming, right? So it's happening. What I get to do is to decide either I'm going to pop up on my board and try to surf this thing, or I'm going to duck dive under it. Both are, or I'm going to do nothing and get crashed and thrashed, right? These are options, but we do have options. And I get to decide as I see this wave coming towards me, what am I going to do? That weird sound is a pug bark. If you can hear it, I know it doesn't sound like a dog bark, which is because their faces are, like pups. So that awareness, that bring it back to the moment. In this moment, I'm uncomfortable and it won't last forever. I'm not actually going to die, right? I think of that meme that's like, but did you die? No, but that's how it feels, right? It's like, that's how it feels. Oh, I love seeing so many brachycephalic family members in the comments. Thank you. One of the things that we do know in ABA is that reinforcement rocks, right? So if you think back to sessions with kids or adults, or maybe you're a consultant and you work with others, we want to provide reinforcement for behavior we want to see more of. When have you last planned reinforcement for you? We're often really good at doing this for others. And then when it comes to us, we experience ratio strain, which really just means you're doing too much for too little. I use the example a lot of, I don't know that I would have gone through the whole dissertation process for a bag of gummy bears, but for a doctorate, I got it together and did it, right? And so are we asking too much of ourselves without enough reward? And sometimes the reward that comes is far off. And so we have to plan some other not naturally occurring rewards and reinforcement for ourselves, just like we do with our kids when we're teaching them new and difficult things, right? So this comes up a lot for students. I do a lot of mentorship for graduate students, and it's so hard because you want to be present in the moment while also like hurry up and get done with this so you can get on to the next thing. But a lot of times you're working for something for a couple of years before you are eligible to sit for the exam or to graduate or get licensed or go on internship, whatever your goal is. And it can be a thin schedule of reinforcement during school. Maybe that's true also for being a new RBT. You're learning something new and that's hard. And if we apply the same process, the same concepts for our clients, which is when they're doing new and hard stuff, we thicken up that schedule of reinforcement, right? We're going to start with consistent or constant reinforcement and slowly thin it. Do more good stuff for yourself. This on the bottom right is part of our onboarding, like our new hire paperwork for team members at Del Mar, and it really asks them what their favorite stuff is, because we focus on providing reinforcement regularly, right? Contingent reinforcement. And I want to be sure that the stuff you like is what you like. Because I like pugs and I like black licorice and I like tie-dye, but not a lot of people like all those same things. And so I want to be sure that reinforcement is reinforcement for you. This one on the top is and these are both freely available if it's something you want to sort of sit and think about. The one up here is by Shannon Biaggi of Chief Motivating Chief CMO, sorry. And it helps you look at what things other than just tangibles or activities do you enjoy, right? I know that, so we update the favorites list periodically, at least every year. And when I refill it out, I often think, man, what is my favorite right now? Or maybe I had put black licorice on here last time, and then people got me a lot of black licorice, and then maybe I'm sort of satiated and I don't really want anymore. Maybe I'll put I don't know what other nerds. I love nerds. I actually have tattoos of nerds. The candies, not humans, although I certainly am a nerdy human. Which really, I love quotes. And there's this quote that says, "Nerds are just people that are so stoked on a topic that all the details matter." And I think that really captures how I feel about behavior analysis and psychology, and is true, right? We want all the details matter. So really spending some time thinking about, what are you doing to reinforce yourself, to provide reinforcement for your own behavior? Social engagement or social connections with others can be a strong protective factor against depression, anxiety, those negative or uncomfortable emotions. It's important to have them both at work and outside of work, because remember, you got to nourish all the areas in order to flourish. And so it's great when you have work support, but your only support cannot only be at work. You've got to have out of work friends too. More isn't necessarily better. Better is better. It's that whole idea of having 4 quarters versus 100 pennies, right? You get to decide. And a note about social media. I really enjoy social media. I've lived a lot of places, and I live in a fairly rural area now. And so it's a great way to meet other folks and connect with them. And sometimes there's stuff that is upsetting, or people that I want to unfollow. And you can unfollow people both on Facebook or Insta or whatever you're on, but you also can unfollow people in real life. It's this really powerful thing. You just stop talking to people. You get to do that. Unfollow them on social media or in real life. They're both options. So making sure that you're really crafting the people around you to be people who are helping you feel recharged. And that doesn't mean only telling you the things you want to hear, right? It's important to also have folks who are going to be honest with you, not just tell you the good stuff. Thinking about relationships, when we are serving others, right? This is kind of us. This is me, and this is the client I'm serving. During session, whether it's therapy, whether it's ABA, whether it's supervision, the light needs to be on this person, not me. This is their time. I got to stay totally focused on them because this is their therapy. My therapy occurs other times. And so it's important, when you're always keeping the light on somebody else, that you have space in your life where you have the light on you. Because as a mom, you shine the light on your child. As an RBT or BT, you're shining the light on your clients. As a psychologist, you shine the light on your client. In some of our friendships and relationships, we may shine the light on the other person a lot. You've got to have your time in the light. You've got to. There has to be, and it's that when the attention's on you, but more than that, it's that when that you are getting what you need intentionally, and it's not you caring for somebody else, it's somebody caring for you in some way. Whether it's at work, it could be a post-it note in somebody's mailbox, right? It could be a text. It could be checking in and listening to how somebody else is doing. But these are between colleagues, right? So your supervisor, if you're a BT, this would be you, and here's your supervisor. Should be this way. If this is the patient, this should be you as the BT. As the owner of our organization, this has to be me. This cannot be me with my employees or with my supervisees. It can't, because this is their time. But I like to be in the light too. So I have a wonderful partner, and I've got a fabulous sister, and I've got great friends who shine the light, and my own therapist, right? I mean, the light gets to be on me. It's so important, because you cannot serve from a cup that's empty. There's nothing to pour out. We can only serve from our overflow. And one of the ways to fill that cup back up is to be cared for and have that attention from somebody else. Boundaries are key. I think this is an area where I still struggle. I struggle in many areas. This is just one. I think it's, again, related to being kind of a people pleaser and knowing that. So my husband works at Home Depot, and he's been there for 24 years. And, sometimes if he hasn't gotten something stocked, or, I'm being punchy, if he hasn't gotten something done, he'll come home and kind of be aggravated that it's not done. Whereas for me, if I don't return a call or I can't see a client, I feel like that person is hurting and that I'm not helping them, and I can help them. And as somebody who has struggled with anxiety most of my life, and also I'm a complex trauma survivor, I know what that struggle feels like. And sometimes it feels hard to hold that boundary. Harder than holding that boundary is not holding the boundary. And then I'll look at my schedule and be like, damn, I can't do all this, because then I'm not getting good care either. So there's different types of boundaries. There's time, so how much time you can allot to something or not. There's emotional, so how much, how close maybe I can get to you or how comfortable I feel. There's topics, so probably at your workplace, there's some sort of topics that you probably shouldn't talk about at work. My guess is religion and politics are two of them. And it's not because those aren't fine topics, it's because people feel really charged about them, in a workplace is a workplace. And so it's not really appropriate content. And then physical boundaries. Somebody should not touch you. You don't want them touching you. Point blank, period. Right? And that goes for kids too. Boundaries are fluid and they change. They can change across people. So I have certain boundaries with my partner, and then different ones with my sister, and then different ones from the person next to me at the gas pump at the Circle K, right? That's not a bad thing. They should be different. Maybe you've experienced somebody who's come up and had really loose boundaries, and they've maybe talked to you the way they would talk to somebody they know really well, and how uncomfortable that feels. There can also be boundaries across environments. I do stuff at home that I wouldn't do at work, right? Some stuff I do at both, right? I curse at both, and but I have to wear pants at work, right? I don't have to wear pants at home. And so it's okay. It's not bad that those are different. It's really a discrimination task, and not discrimination in the way that we use it in behavior analysis. So under what conditions is this okay? It is okay to not wear pants at home. It is not okay to go to the office not wearing pants. And then across time. So there's boundaries that I have now that maybe I didn't have in my 20s or my teens, and vice versa, right? There's things that I'm not as, so I used to not share. I used to be really embarrassed and feel ashamed that I had dropped out of high school, and that I had been sent away to a residential treatment center, and that I had survived these traumas, and even that I had MS. Like, these were things that I wanted to hide from people. And now, like, none of that defines me. And in actuality, by sharing them, they define me less, and they can't be weaponized against me. And I've met all of these other humans who've had similar experiences, and I don't feel so isolated and weird and alone. And then there's strategies for setting boundaries. So here's some examples. Here's some language. Other things are not answering emails after work. Yep. Or if you're in a leadership position, and likely being available after work is part of that, you still get to set off a time when you aren't available. It doesn't mean you're on call 24/7. Maybe you check emails for emergencies up until 8 or 9, and then from there till the next morning at 6, you don't. It isn't so black and white, right? So I need to be available, but not all the time. And so it's not that you're available outside of work or you're not. You still get to set boundaries on that. So maybe you're open to answering emails or taking calls until 8, but if it's after that, it needs to wait till tomorrow, or it needs to go to someone above you. That's allowed. You are not on call. That break and rest time is important. Otherwise, that's when we recharge. And if you don't get it, then you're actually never getting a break from work. And that leads us to feeling more burned out. I use something called Boomerang in my email. We have a HIPAA compliant company email, and so it syncs with that just fine. And so if I am answering emails after work, like my husband's at work right now, so I'm clearly doing a little work, and I have an amazing team, like, could cry, they're so awesome. And I know that they want to do a good job. So if I send them an email after hours, they're going to respond. Even if I tell them don't, they're going to. And so part of my caring for them is hitting send later so that it goes out the next day during business hours. Sometimes I forget, my fingers get going too fast, and then, I got to own that. But really think about for your team when we are engaging after work. And it's the same with parents. You get to set a boundary with the parents you work with. We are not a crisis center, at least Del Mar isn't. If you're working in a crisis center, there should still be somebody to cover for you so that you can have space to rest. Cannot work all the time. This reminds me. So we have a giveaway. This is a book that I think is fabulous. It's called Set Boundaries, Find Peace. It's by Nedra Tawwab. She also is located here in North Carolina. I am going to, I have another can you guys still see my PowerPoint, or can you see the spinner I have up? Never done this before, so I appreciate you. Oh, you see the PowerPoint. Okay, so I have not done something, which is fine. It's an opportunity to learn new. All right, so stop share. Now I'm going to share another screen. Basically, what I learned how to do was, well, let me show you, because I feel like I'm going to steal the thunder. Okay, so can you see a spinning wheel? And now I can't see the chat, which is really my life in a nutshell. Fabulous, thank you. Okay, so I found this website where we can do a random name generator. So what I did was, these are the 258 people who signed up, or 223 people who had signed up by today, when I found out that I needed to do the presentation tonight. And so I'm going to give away 3 copies of that book by Nedra Tawwab about boundaries. I mean, it's so good. It's so good. And I put everybody's email addresses in here with what you signed up as. And so I'm going to select 3 of them. The 3 of you who are selected, if you either put in a private chat, or you can email me directly to the email address that I've been sending stuff out, a mailing address that you're comfortable with, I will send it your way. Okay. Oh my gosh, it even has sounds. Yay. I feel so techie and cool right now. I'm like leaning in. I can't wait to see who's going to get it. Okay. Let me take a screenshot of this. Yeah, fancy. I appreciate that, because well, okay. So we'll do this. But they're not here. So maybe, oh, fabulous. I will, let me take a picture of this. Fabulous. So congratulations. Yay. That's 1. I'm like insanely excited over this, both being able to figure this out and that it worked, because that does not always happen. Yay! Let's get another one. Is Ariella here? Yeah, it's always great when technology happens. It doesn't always. Okay. So let's do another one. All right, is Tiffany here? Oh, okay. Let me take a picture of that. Thank you. Are any of our other 2 winners here? No, I will email them. Yes, very exciting. And yay, technology worked. I have read this book twice. And I also, let me get back to my PowerPoint now. I've also listened to it on Audible, and she reads it herself, which I always love when I got too much happening here. When the author reads their own book, I always think that's fabulous. So I hope that is enjoyable, and I again share whatever mailing address feels comfortable for you, and we will I will get it in the mail. Okay. All right, Becca. I'm so excited about the daggone technology. I can't. All right, self-care. So I am here for the self-care. I also kind of have beef with self-care, because what's been happening is I feel like people are self-caring it to death, right? So self-care is any intentional behavior aimed at taking care of you. It's got to be on purpose. You did it on purpose. And it's a necessary part of wellness. And there's all these different categories. We've got physical, emotional, social, spiritual, work, financial, environmental, personal. We got to pour into all of them. And it's function over topography. So if eating chocolate is self-care, if I've got a history of poor eating habits when I get stressed, I don't know that eating chocolate is self-care for me. It can be for you, but not for me. Or spending money on a purse, like splurging on a nice bag. That's one of my splurge items. And if I buy that and we've got the money to do it, great. But if I buy that instead of paying our mortgage or buying food, guys, that's not self-care. That's actually a maladaptive behavior aimed at reducing the anxiety and stress that you're feeling, not self-care. So it's not topography, it's function. Why are you doing this? And just like sometimes self-care isn't pretty, like getting shots or taking my chemotherapy. It's not awesome, but it is longer term awesome. It's taking care of myself in the long run. So it's not always pretty, and it's not just massages and chocolates. Really think about, what do you need to be well? My other beef with self-care is that I feel like it's being weaponized. So people are saying, well, just practice more self-care. Yeah, but self-care is not enough. If you are in a system that is not caring for you, that is systematically not caring for you, right? And so community care is an intentional system set up to care for the members of that community. And that's what this is. That's our intent, is that this is a month-long celebration of the hard work that BTs, RBTs, paraprofessionals, DSPs do day in and day out, and acknowledging that our BTs and RBTs are our most vulnerable employment position within this field. Sometimes there's no PTO. There's a lot of times part-time hours. Maybe you don't have health insurance. Is your environment safe? If you're in homes, do you have what you need, like a clean place to pee? Do you have the stuff that you need? Do you have adequate supervision and support? And so it's really about taking action that's aligned with your values. And our value at Del Mar, and mine as a human, is caring for others. A healthy and well community is one that benefits all members. And our communities, whether it's intentional or unintentional, are set up to care for some people more than others. We've got to dismantle that. And then we need to reinforce using those systems and programs. So having an EAP, having health insurance, making sure people have the ability to say they want off a case if they need to, that you're not working with the same individual for long periods of time, that you're both burning out on each other and the client's not getting the best care. I mean, these are important. And so I love this quote by Desmond Tutu that says, there comes a point where we need to stop just pulling people out of the river. We have to go upstream and find out why they're falling in. Have to. That is the responsibility of everybody in the community. And this is an action step for us. Compassion. Compassion is empathy plus action. So Dr. Kristen Neff is a psychologist who studies self-compassion. And so oftentimes we're really compassionate towards others, but not towards ourselves. And you and me, as much as anyone else, deserve the kindness and compassion we so freely give to others. And this isn't just frou-frou, hippy-dippy stuff. This is science. You can go to her website and take a look at some of her literature. But there's 3 components to self-compassion. Self-kindness, so talking to yourself in a kind way. So when I couldn't figure out how to get the toggle back and forth between this, I could have been like, dang it, Becca, you just messed up. Now it's ruined. Everything's going to go terrible. Everybody thinks you're stupid. This is a waste. Womp. Or I could say, oh, Becca, didn't work. Try something different. Everybody makes mistakes sometimes. It's a very different feel. And then recognizing that common humanity, everybody does make mistakes. My pile of shoes that I refuse to put away that just like pile up after work, everybody's got something like that. I'm not gonna hide that, I'm gonna let you see it. I'm not the only one and you're not the only one. I had pie for dinner. I had apple pie that I ate for dinner while I was working on this presentation. And I'm all right with it. You know, it's okay. And these are shared experiences. You are not alone. But that's the story we tell ourselves, right? Is I'm the only mess. I'm the only one who ... You're not. And when we know we're not alone, we don't feel so lonely, right? It's a shared experience. And then mindfulness, again, staying in the present moment. So if I make a mistake and I take it all the way to catastrophizing, which is, I'm homeless in a cardboard box somewhere, right? I have gone 10 shades past what happened in this moment. I need to bring it back to this moment. In this moment, I am here, made a misstep. It's uncomfortable, not going to last forever. Got to keep it moving, right? So that pug on the bottom left wearing the crown is a reminder to me to talk about the noble intention, which comes from functional family therapy, or FFT, which is an evidence-based intervention for families that are volatile, right, or have lots of yelling and screaming. And it's a reminder that everybody's doing the best they can with what they've got, even when the behavior that we see is not what we want to see more often. So mom yelled at me a couple weeks ago. I mean, like really lit into me. And my feelings were hurt and I felt some kind of way. And I've known this mom for a little while. And when I could pause and remember that her yelling at me, really what it came down to is she loves her son. And she's frustrated by these TRICARE changes. And she's worried that it comes down to, she's worried he's not going to get services. And she's scared. Man, I lean into that. When I think somebody's just being a bee or they just, they don't care, we lean away, right? I'm like, ugh. But when I hear another human being is hurting and they're afraid, man, I know that feeling. Tell me more. How can I help you? Like I hear where that comes from. And so it allows us to connect and lean in and understand what's happening. And while I use the parent example, it happens to kids too. Hell, it happens to me and I'm a psychologist. I snapped at my husband and really it was that I hadn't planned well and I thought I had let somebody down. So I was wound up about it. And I react by being snarky. I mean, I apologize. And it came from this place of worry and fear and wanting to do the right thing. And I didn't. And so when our kids punch or kick or, yell at you, it just isn't personal. They are having a hard time, not giving you a hard time. And remembering that is a game changer. And whether it's the person that cut me off at the Circle K to get my gas tank, or the parent that yelled at me, the child that chucked something at me. Remember that slide with the pie, Miss Minnie's chocolate pie? It's been a hard year. It's been a hard almost 2 years. People are doing the best they can. Yes, giving grace. That noble intention. We are all doing the best we can with what we've got. And when we can remember that sometimes the behavior we don't want to see more often comes from a place of hurt, right? Hurt people, healed people, heal people. We can lean into that hurt and join with them. Other strategies that don't fit under one nice header, the pause button. It's really important when you notice yourself getting woundy, hit that pause button just for a moment. And you decide how you want to respond, not react, right? So when I go to my neurologist and she hits my knee with and trust does my arm with that like hammer thing for a reflex, I don't choose to kick or move my arm, it just happens. That's a reaction, right? What we want to do is respond. And sometimes when I'm getting wound up, I need to pause for a moment and think about how I want to respond. That ACT, acceptance and commitment therapy. It's not ACT, it's ACT. And acceptance and commitment therapy. And the reason it's ACT is because it's about action. It aligns nicely with behavior analysis. So how do I say that different? I am an ACT-oriented psychologist, and it talks about the power of language and thinking flexibly. And it has been a powerful tool to me as a patient, as well as me as a clinician. And so Dr. Russ Harris is an excellent human, but is very skilled in ACT. You've probably heard of Dr. Stephen Hayes, who's also excellent. His work tends to be a little more theoretical. And so if you're really looking for something you can take and use, Dr. Russ Harris is great. And he has lots of free videos on YouTube. His books are affordable, and he even publishes some free worksheets that go along with his books. That black or white picture with the red X over it is a reminder that it's not now or never. It's our anxiety. It's if not now, later. Yes, Dr. Russ Harris. Yes, I'll put that in the chat. Sometimes we think I have to say yes to this or I won't have any more opportunities. Nope, not now or never, now or later, right? Even the way I noticed my tone change saying that can be a powerful sort of self-reminder. This shades of gray reminds me that it's not black or white, yes or no. There's so many different options. Remember, I was talking about like if you're available outside of work, it isn't you're available outside of work or you're not. It's maybe you're available to 7 to 8 to 9. Maybe you are available Tuesdays and Thursdays, but it's not yes or no. You get to decide. Yes, that and stance. Yeah. And then this, stop filling up your to-do list with a million things and then feeling shit when you don't accomplish everything. You are not superhuman. You can be wonderful. And sometimes our goal setting sucks. right? If we set a goal for a child to read 100 words in 10 seconds and they don't have vocal verbal language, is anything wrong with the kiddo? Nope, that was a crap goal. Sometimes we put too much stuff on our to-do list. Sometimes we make a goal that's unreachable, but then we give ourselves grief for not reaching the goal when in actuality, the goal was the problem. And we would never do that to the kids and adults we serve. And yet we don't use the same stuff that we know works on ourselves. We know it works. That's why we're in this field, because we've seen its power. Turn it around on us, because myself and all of you are as worthy and deserving of this powerful, robust life. And our science can help us get there. Create a plan. So this is important. Don't wait till you feel like crap to make a plan for how to feel better. Make a plan when you're calm, right? You rock at writing plans and goals. Give yourself some of your own magic, right? So these are just examples. So this is a self-care action plan I use in therapy. Signs of burnout, stress relievers, people you can reach out to, and helpful reminders. Do not try to do this when you feel like crap. Our brain, it's, I'm gonna check my time. Crap, I'm running out. Okay, so your brain gets amygdalated. You get wound up, your amygdala takes over, your lid flies off, right? So this part, your lizard brain, is taking over. Lizards, I mean, they don't engage in this like executive functions of planning, organizing, inhibiting certain emotions while doing other things. Do this when you're calm, when your frontal lobe, your prefrontal cortex is working and firing. That's when you make your plan, so that it's ready when you're woundy, then you can pull it out. Cope cakes, these are just cute. I love them. I use them with kids in therapy and with our team. So sometimes we'll splurge and get like the fancy cupcakes from the fancy bakery, and then, you know, everybody can color this in and kind of cope, right? Make a plan for coping. Feed your dinosaur regularly. It's not a one and done. This is an ongoing process, just like we don't reinforce kids for doing something once and expect it to stick. Don't expect that of yourself either. I do want to be clear that you cannot self-care your way out of things, and that self-care is helpful but may not be enough if you're experiencing a true mental health condition or symptoms. If you are having difficulty more days than not, and for more of the day than not, do reach out to a mental health professional for support. You are important and it can get better. If you have health insurance, it's covered, most likely. Most insurances are still covering telehealth. So a couple of days ago, I did therapy virtually with a mom who was sitting on the floor of her walk-in closet because she couldn't get away from her kids anywhere else. Look, we've seen it all. It doesn't matter where you are, just show up. If you don't have insurance, you don't feel comfortable using it, I compiled a list of a variety of different free mental health resources. These are all staffed by licensed mental health clinicians who donate their time. I tried to indicate if there was a specialty for, like, I think there's a trans lifeline, Trevor Project, LGBTQIA. Some have English and Spanish. The tribe wellness community has a variety of languages. So I tried to indicate some more specifiers so that you can help decide what's the best fit for you. Maybe you take a screenshot of this and post it somewhere. Maybe somebody else needs to see it. This is Brandy Pug. She is a surfing pug in Del Mar, California. And those goggles she's wearing are actually called doggles, and that's fabulous. This is a reminder about balance. So often we think that balance, once you've achieved it, it's a static process. Now I'm balanced and I'm done. So when I get knocked off balance, I must have done something wrong. But it's not. It's like surfing, right? So surfing, you pop up. It's an active process. I can't pop up and stand there like a board and expect to not fall off. I gotta, you know, as the wave goes this way, I gotta lean forward or back or stand straighter or scrunch down. It's an active process. You're part of the wave. You're part of it. It's dynamic. You're never done. I think somebody said before, prioritize and pivot. Yes. What worked today is not going to work tomorrow, and it didn't work 10 years ago, and it's not going to work in 3 months. And none of that means you failed. It means what you need to stay balanced each day is different, because each day is different. Some days you sleep well, some days you don't. Some days you have more work, some days your kid's sick, some days fill in the blank. what gets us stuck a lot of times is thinking that it is like done. Like once I've got this plan, it's going to work forever. And then when it doesn't and something changes, we're so thrown off. But this is one of those times where our goal is imperfect. That can't be the goal, to have it planned out and not have to modify. The goal, a better goal, a more healthy goal is this plan works for now. And it's going to have to change. Not because I'm not wonderful and not because the universe isn't wonderful, but because the only thing constant is change. I can't fight it. It's like those finger traps. Do you remember those? Like you do like this, and like the harder you try to make it happen, the tighter it gets, the more stuck you get. Go lean in. Less is more. I appreciate that, Anita, and I hate that. It's the and stance, right? I feel good hearing that. And I feel sad that others don't experience that. And let me also say, my employees aren't always happy with me. One of the things that's hardest to learn for me is that I am not ice cream and I'm not going to make everybody happy. And when I stay aligned with my values, I will make me happy and not at the cost of anybody else. It's hard. And I do appreciate that. And I also, that is my job, right? I see clients, and a big part of my job is making the decisions to take care of my team members, because that's taking care of the clients. When you are healthy and well, you do good work. And my responsibility is to make sure that every child that comes through that door gets good work, not just good work, the best. So I'm hard. I'm tough on my team. I expect a lot. And if I expect a lot, I damn sure better provide a lot. Okay. Thoughts, feelings, reactions, questions. It's okay if not. It's also okay if there is. Let me. You're most welcome. You're most welcome. I'm so glad to hear that. And let me see if Miller, are you here? I probably should have just texted you instead of just calling out. Perfect. So Miller, I am going to make you a co-host if I know how to do that. It might be an excuse, but how do you do this with staff when you are bound by ratios? Tell me more. You know what? Outside of ratios, what I hear you saying is there's competing contingencies, which I agree. Insurance does not pay as much as they should for our team, and they do not pay for everything. They don't, I mean, they're tough to work with. And I decided that my value was taking care of my team. So our profit margin is less than other organizations. I pay myself less. I also, there's no pillow soft as a clear conscience. I feel really good about the work that we do for the kids and for the team. So for me, it's about deciding what I could give, what I was willing to give up in order to meet the needs of everyone as best as I could. And so, I don't know if that answers the question. I acknowledge it's hard, and you just got to pick your hard, the staffing ratio. Yep. So then we need to hire more. So what I'm seeing is you work in a residential facility, the staffing is 1 to 3, so they can't get time when they need it often. I got to tell you, then you got to hire more staff. Then you got to have a floater. That tells me that we're so short staffed. And I don't mean this as a negative. I've been there, right? So people need time. And here's what I've learned. Either you give them the time proactively when they need it, when it's a little bit of time, or they're going to take the time because you're going to lose them. It is a hiring crisis. Look, we've got 6 open positions. I mean, I'm not saying it's easy. I'm saying for me, it's, I got to take care of the team I have, or I'm going to have even less of them. Okay, so I am acknowledging that I do not know how to add somebody to this. Let me pause the recording. Actually, let me stop this one.